I'm Lieutenant Governor Tim Murray. Today's topic has been what are we doing, strategies of addressing prevention and addiction issues, drug and alcohol issues statewide. There's really been no better leader on how we can be more strategic in preventing issues of drug and alcohol abuse and treating issues of drug and alcohol abuse than my guest now, Senator Steve Tolman. Welcome, Steve.
Thank you, Governor.
Report.
Thank you.
Well, I want to get right into it. You, as I said, as chair of the Interagency Council on Substance Abuse and Prevention, have been a great ally and somebody who has been a leader throughout your time in government. But most recently, you completed the OxyContin Heroin Commission that did a series of hearings across the state and came forth with a series of recommendations about how we battle this epidemic. And I think it's fair to say, when you look at some of the numbers, we've 3,000 overdoses from 2002 to 2007, and deaths, opioid-related deaths. So, what do we need to be doing better? What have we done well? And what, let's focus on the recommendations of the report. I know there's some things that the administration has been working on under Governor Patrick's leadership and with the support of the Interagency Council that I chair. But there's some other things. So we could kind of go through those.
Yeah, and we live it, and you're a great partner to have, believe me. And I think we're right at the cusp of making some significant gains. It's kind of like an out-of-control horse. We got on the horse, we got the reins now. And I think that's about where we are with this heroin epidemic. And I'm pretty excited about it, and believe me, thanks for your partnership. You and the governor have just been fabulous on this. I think the biggest, we had 20 recommendations in the report, Governor, and 20 recommendations of what we could do different. And many people thought it was going to be difficult, but when we met with your administration, you stepped right up to the plate. You hired this new person, Alice Bonner. She's a nurse practitioner, and anybody that knows a nurse practitioner, they're on the ball, they're doers, they accomplish their tasks, and you've got her up and running for the prescription monitoring program. And for those of you out there, what that would mean is that there'll be no more doctor shopping. Many of the addicts use that as a tool to be able to obtain more medication than they should have.
Use them, sell them.
Right, and it's unfortunate, but that's, when you're sick and you're an addict, you do anything, and that's one of the biggest ways that we've found it's really abused in the street, and we're on top of that.
And the logistics behind that would be, so once the prescription monitoring program's in place, which we anticipate will be October.
It'll be by the fall, and they'll have steps of it in place even before that.
So if I was going to, Dr. Tolman for some Vicodin on Monday, and then Tuesday I went to Dr. Cohen, and asking for the
what
same
they would
thing.
do is they'd go right in and see Tim Murray, and they said, well, Tim, you were just over in Rosendale when you just got a prescription yesterday for such and such.
Right.
But even more important to that, for the listeners, I think it's very exciting to also know that when Dr. Cohen is prescribing, that's all recorded too. And so we're going to be able to evaluate, we had the problem about 8 years ago, whenever it was, with that Dr. Brown down in the Cape, who actually prescribed 287,000 prescriptions of OxyContin, 1/3 of all those issued in the state. So we're going to get to both sides of it, Governor, which is real exciting. That's a prescription monitoring. And that's going to save, many, many millions of dollars in Medicaid fraud, because don't forget, a lot of these people are Mass Health, and they should be able to pick this up. So we're going to really, it puts a lot of accountability in the whole system, and you guys have just been moving so quick on it. Everybody's excited about it.
And it also, just to know, one of the things that maybe you're going to get to, but in working with the doctors across the state, many of them said, listen, when we were in medical school, there isn't a lot of time on pain management and understanding when prescribing is appropriate and when it isn't. And one of the things that we're talking about is training. That's
huge, and that's a big piece of it. Training for docs and patients. Because remember, the pharmaceutical industry comes around and says to the docs, oh, best thing since sliced bread. They did it with OxyContin. In particular, the book Painkiller, written by Barry Meyer, the New York Times reporter, indicates this, that they actually come out, best thing since sliced bread, only going to take one pill, not addictive, everything's wonderful, please sell my product. Everyone thinks it's a wonderful idea, but what they didn't tell, unfortunately, the docs, is that this pill could be tampered. Taken normally, you swallow it 12 hours, you don't take any medication. But if you crush this or chew it, you break up the time release, and it is very powerful because it's an Oxy 80 is like 15 5-milligram oxycodone or Percocets. So it's just outrageous. And the bottom line is that it's out of control, and you're putting pieces right in place. You know, Governor, the other big piece that we're looking to do, and there's a whole bunch, if a doctor or if a pharmaceutical industry sells all these Schedules 2s, 3s, 4s, and 5s, which you'll have them all up and running under the prescription monitoring program.
And the schedule is a reference to the drug type.
Yes, but like 2 is heroin and OxyContin, but not heroin, but it's OxyContin. And then, you know, 3s might be Vicodin, 4, all of the kind of very powerful drugs. But the most